So Mr. Serrano-Sewell should be here momentarily. I think we're going to start now, get started now. And I want, before we formally start, we will, I lost Dr. Gananadev. We will actually, when we convene the board meeting tomorrow, formally, we will acknowledge and ask for a moment of silence to commemorate the unexpected and devastating death of our colleague, Dr. Janet Salmonson, who passed away shortly after returning from a medical mission that she was involved in the late summer, early fall. And we were devastated to learn of her loss. A young woman with enormous capabilities, a giant heart, and someone who has contributed enormously to this board and to her patients. And so I will acknowledge her at the full board meeting, but I really didn't want to start today without also mentioning that even though Janet, her last meeting was July, we will miss her terribly and are very saddened by the loss. So I'm going to now convene the meeting of the Executive Committee of the Medical Board. And I want to ask everyone to please turn off their cell phones or turn them on silent and stun. Make sure they're off the table so we can avoid feedback. And I think everyone here understands that committee members may be using their laptops to access committee materials. I brought mine to the board meeting in paper, and it required a second suitcase. So I think computers are a great advantage to conducting our business. This is an official meeting of the Medical Board of California, and I will try to conduct this committee meeting as effectively and efficiently as possible, and without unwarranted disruptions. We have a designated time on the agenda for public comment. We'll ask for public comment on each agenda item. And if I forget to ask, my colleague here will poke me in the ribs, as she has been doing during her, since she joined the board. We certainly welcome comment on any item on the agenda. We are going, one of our agenda items today is to walk through the strategic planning document that we have revised substantially since it was created in the fall of 2012. And we will be taking comment both from board members as well as from members of the public after each objective. So it'll take us a bit of time to get through it, but it's long enough and expansive enough for us for me not to feel it's not fair to ask people to remember everything they wanted to say. We will ask speakers to stay on topic and keep your comments to 3 minutes or less. And I'm going to call the meeting to order now and ask Ms. Tuve to please call the roll.
Dr. Levine?
Here.
Mr. Serrano-Sewell?
He's here.
He's here. Dr. Diego?
Hey.
Dr. Gananadev?
Here.
And Ms. Yaroslavsky?
Present.
Thank you.
Great. Okay. I have one speaker slip for items not on the agenda, and would ask if anyone else would like to make a comment on something not on the agenda to please get a slip from Ms. Toof and fill it out. Karen Ehrlich.
Good afternoon. I appreciate the opportunity to talk to you today. I am Karen Ehrlich. I am the Vice Chair currently of the Midwifery Advisory Council. I first of all want to say that we are, by far most of us in the state of California, are thrilled with the passage of AB 1308, and I appreciate any help that any of you might have offered as it went through the legislative process. It came to my attention maybe a couple of months ago that somewhere during this year, as that bill was in process, there was one time where the Executive Committee discussed some of the provisions in that bill Unfortunately, there was no licensed midwife in the room during that discussion. And I think that if there had been a licensed midwife present, you would have had a much more thorough conversation about it. There would have been much more accurate detail. It would have been, I think, a really smart thing. It would have made sense for that discussion to have taken place with a midwife present. I would like to ask that you do everything you can to make sure that there is a licensed midwife in the room to be able to fill in the gaps for you when you are talking about any of our issues. Thank you.
Thank you, Ms. Ehrlich. Anyone else wish to speak on an item not on the agenda? Okay. We'll move to agenda item 3, approval of the minutes from the January 31st, 2013 Executive Committee meeting. I have a motion. Do I have a second? Second. Are there any additions, corrections, or comments on the minutes of the meeting? And I will ask that if board members, as you go through the minutes, if there are typos or language errors that are not substantive, that you just note them and then give them to Kim so that we don't actually spend time at our committee meeting or our board meeting correcting typos. And I have a whole bunch, which I'll give to Kim at the end of the meeting. So hearing nothing, no substantive questions, I'd like to ask for any public comment on the minutes of the January 31st Executive Committee meetings. If seeing none, hearing none, all in favor of approval of the minutes? Aye. Any opposed? Any abstentions? Okay, the minutes are accepted. As most of you know, we adopted the board's strategic plan in early 2012, the same year we completed our Sunset Review report. And since the completion of that report and on reflection on how that plan was put together and the process we went through, as well as the findings and responses of the Senate and Assembly committees, we felt that we needed to review the strategic plan and make certain that it's in line with what members feel are the current important goals and objectives of the board and where we, as board members and where staff, ought to be spending their time. It's very important that the plan truly capture what the board's intent is and communicate to all of our stakeholders and constituents where the board resources will be used. Given that every one of us in the private and public sectors operate in an environment of, we don't operate in an environment of unlimited resources. And we also made the determination after working with our colleague in the DCA, who's going to be making a presentation to the committee, that the strategic plan should not capture items that are within the standard or normal business processes of the board, that the plan needed to be somewhat at a higher level and not capture routine business activities or business processes. I met with Kim to discuss a proposal to review the plan, and then Mr. Phil Tagami offered to join me as a two-person committee to revise the plan and to bring forward revisions to the committee. We constituted ourselves as an operational effectiveness committee and sought consultation from Mr. Tom Roy, who's here with us today, from the Department of Consumer Affairs. And he's going to lead us through the process. Mr. Roy's been working in strategic planning with the Department of Consumer Affairs since 2010 and has facilitated successful planning and implementation of over 20 strategic plans for a variety of boards, bureaus, and programs within state government. And we've asked him today to walk through the revisions and to lead us through the thinking and the process behind the creation of a strategic plan, one that accurately reflects the goals and objectives of this board. Mr. Roy.
All right. Hopefully I'm live. I can't really tell. Okay. Thank you, Medical Board, for inviting me here.
Can you all hear him?
Not on. We understand the concept.
Hold on a second.
There's a little button there.
It says power on. This one? On now? It's green.
It's on. I think you just have to move this.
Okay, am I louder? All right, I can project a little bit more. Hello, Medical Board of California. Thank you for inviting me down here today. Thanks again for the introduction. It saved me a little bit of time. What I'd like to do is start basically by describing how I envision us getting through today. Firstly, as she said, I have done many strategic plans, and one of the elements that we always deal with strategic plans is kind of getting into the discussion of specific words. My role today is to capture as much of the documentation as possible. I'm going to walk through the timeline of going through the proposed objectives that came out of the discussion with Dr. Levine and Mr. Takami. For the purposes of this presentation, I've only included the clean version of the objectives. If you have your board packet and you want to look through the strike-through to find out what was removed, we can do that, and I can pull it up on a separate document if necessary. But my goal is a neutral participant. I'm just here to help facilitate the meeting and capture the content and document the discussion. Here's a little roadmap. And part of the facilitation I envision, I'm going to sit down and type to try to capture everything. But as Dr. Levine mentioned, I met with Kim initially to discuss what the medical board needed. And then we met with the Operational Effectiveness Committee, to discuss augmentations to the strategic plan, as well as we reviewed some staff suggestions and edits. Today in the planning session, and normally when we do a strategic planning session, it can be a little longer, so this is going to be, am I in frame? Okay. We're just going to be reviewing those goals and action statements, and as Dr. Levine said, we'll take an opportunity to discuss if there are any missing areas that we need to potentially add or modify. And following each objective area, what I'd like to do is I'd like to assign it a priority. It's very important in strategic planning to determine which of the objectives need to be accomplished first, given there are limited resources and sometimes limited time. Following that, after we complete that at the end of today's session, I'm going to talk about next steps, which is going to be involving working with staff to determine those specific actions that accomplish the overall objective. And following that, we'll have a compiled plan, which we'll deliver to the board at the February 2014 board meeting. So really quickly, we're just going to go through the proposed revisions. We're going to look at the goal statements, which each goal has an action statement behind it. Some of them were modified during the course of our teleconference. If there are any changes that we'd like to suggest for those, we can do so at that time. And then we're going to go through and look at those objectives. Okay, so the strategic plan is made up, obviously, of the mission, vision, values, goals, and objectives. The goals, as were previously established, are the same. The action statements behind them are as follows. The modifications to professional qualifications are to promote the professional qualifications of medical practitioners by setting requirements for licensure and relicensure, including education, experience, and demonstrated competence. The action statement for regulations and enforcement was proposed to protect the public by effectively enforcing laws and standards, and consumer and licensee education to increase public and licensee awareness of the board, its mission, activities, and services.
Okay.
At this point, I just wanted to find out from the board members present if they have any thoughts or feelings or changes to suggest on any of these action statements. Otherwise, I will proceed.
And as Tom said, this is just the headline, and then following from this will be objectives and action plans.
Correct.
That will be brought back to the board. But this is just what we're approving today is the framework. Ms. Yaroslavsky?
So I just want to be clear on what our responsibilities are. So we're going to be taking a look at just the broad concepts and approving the broad concepts and nothing underneath at all?
No, we're looking at the broad, oh, sorry.
So I read all this for no reason?
No, no.
We're starting at the broad concepts, then we're getting into the objectives.
And then we're
Well,
getting into the objectives.
Okay, so when we get to the objectives, then I've got.
Okay. Any comments from board members on this? Any comments from members of the public on this? Okay.
I'm going to follow to the remaining 3 goal areas, and then we'll get into the objectives. Organizational relationships, build relationships with related organizations to further the board's missions and goals, organizational effectiveness, evaluate and enhance organizational effectiveness and systems to improve service, and lastly, this is quite the mouthful, access to care, workforce, and public health, understanding the implications of healthcare reform and evaluating how it may impact access to care and issues surrounding healthcare delivery, as well as promoting public health as appropriate to the board's mission in exercising its licensing, disciplinary, and regulatory functions.
Whew.
That sounds like, all right. So now we're going to get into the actual objectives, unless
Any questions about these three? In many ways, these six really are carried forward from the last strategic plan. There isn't much here that's new. What we've done is tried to clean up the language and state them in six coherent goals that fit with the board's mission and purpose. Any questions or comments from members of the public? Okay, Tom, take it away.
Okay. Now we're getting into the real meat of today's meeting, which is the objective areas. Now from this, what I'd like to do is I'd like to review the proposed changes, discuss any language modifications that we need to, and then address any areas that there might be lacking. We may have missed something, and a new objective might need to be proposed. Following that, after public comment, hopefully, I'd like to assess a priority of the objective. I'd like to do it by a number scale, one to be the one accomplished first, but if that becomes too difficult, we can do a high, medium, and low strategy. But I think, given that there are 4 of us, that we can determine one, we can use the number scale. Okay, so this is under the professional qualifications. We already discussed the action statement. So these are the two. For this one, there's only...
Tom, before you go on,
Sure.
I think it's actually more useful to think of this as a 2-by-2 matrix. Importance and temporal sequencing are really two different things. There may be things that are very important, but because of the timing required, but for example, the issue of maintenance of licensure, it may be very important, but we're ways away from being able to evaluate the pilot, the FSMB pilot. So I think it might be more useful to just have a 2-by-2 matrix.
This is a new system that we tried on one of our prior boards. We did high, medium, and low first, and then we went back and did a priority numerically.
Okay.
So we can start with a high, medium, low, and then just organically high priority items tend to be 1, 2, and 3, medium, and low.
Okay.
But going into this, and this is where I'm going to probably go into a sitting position to try to capture everything, but this is 1.1 as it was proposed and modified. And some of these were combined into one objective versus just to encapsulate all of the ideas of several objectives into one objective. So 1.1 is examine the Federation of State Medical Boards maintenance of licensure and American Board of Medical Specialties maintenance of licensure initiatives to determine if changes are needed to existing requirements, continuing medical education in order to ensure maintenance of competency of California physicians. Would it be helpful for me to read this or just discuss each item as a group?
We already read it, I hope.
You've already read it. What's the
My question is, I think that we've read it, or hopefully we've read it, and if we haven't, we should be able to catch up real quick. It's not
Okay.
too deep, or
What
it's
I
not
like
too
to
many
do
words.
is I'll.
But unless you like reading out loud, I mean, I can sit here and listen.
Why don't you go through
There are a lot of technical language.
Yeah, there is. If you go through the objectives for each of the goals as a body, and then we can take questions on those. So.
Okay, so for objectives 1.1 and 1.2, before we determine if there are additional ones that need to be added, I'd like to discuss these and find out if the board is okay with approving these as is.
Ms. Yaroslavsky?
So I'm going to suggest that in reading all of this with the corrections, I read it, I didn't read the red line first, I read the other line first. And my question is, and it will be on all of them, I think, as to what is it trying to change? Has there been something that's been a barrier or a weakness in the system that needs to be beefed up? Or in fact, are there ways that we could, so I'm not so sure what we're doing, in the level of intensity or importance, what we're discussing for why. So for example, on this first one, if you go back to professional, promote the professional qualifications of medical practitioners by setting requirements for licensure, relicensure, blah, 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 are those rules of the game going to be changed based on what you have underneath? Or is it going to add stuff to it? And why, I'm not clear on, it sounds like we're writing them from scratch and we're reinventing the wheel. So my concern is that within the process, that if there is a weakness or barrier to what we've been doing, I think that needs to be identified and pulled out.
So, to be specific on this one, the current requirements for licensure in the state and the requirements for relicensure, this is raising the question of, that has been raised by others, as to whether additional requirements beyond traditional continuing medical education, in California it's 50 hours every 2 years, is still sufficient
Right.
to ensure maintenance of competency of California physicians. This isn't providing the answer that says,
Right, but is your question, what you've just raised now, encapsulated in that verbiage? It really is.
yeah, examine the processes that FSMB is undergoing, ABMS has already been doing for a long time, to see if changes are needed to, maybe for clarity it should say, to existing requirements in California.
Right, see, my concern is that if FSMB is going to be the benchmark, or is the Medical Board of California going to set the standard? And I just thought that there wasn't the clarity that I wanted to see in this. And that might be just me, the layperson, you doctors know what you need to do anyway. But if I were to be the consumer taking a look at this, I'm wondering, well, what have they been doing up until now? Haven't they been doing this? Or are they looking to increase the requirements, and those requirements are from FSMB? And I wasn't clear.
So I think perhaps it would be clear if we added the words "to existing requirements in California,"
Okay.
which currently are CME.
Thank you, Madam Chair. It's basically what it says is that we are looking at two organizations to see what their guidelines are and look at ours and see if we need to do anything to improve. That's all I'm getting out of this, because, right, there is, if you look at the ABIM went to the maintenance of certification. So it's not just taking the exam every 7 to 10 years anymore. You have to be doing specific CMEs where it's not just sitting through a meeting, but also you have to answer the questions and you have to have higher than 75% correct answers, so that then only those things apply. So these are the.
So I think the clarification in California helps me a lot.
And if we go back, and the goal, the larger goal, also included licensure. This objective doesn't actually stipulate that, and I suspect that's for a future time. But this is the objective number 1 is about maintenance of competence, which currently in California is 50 hours of CME every 2 years. There are some states in which CME is explicitly prohibited except in disciplinary actions, which is why those states have actually started looking for something other than CME to demonstrate competence. Colorado is one of those states.
Dr. Levine, you proposed some language, and I wanted to make sure I captured it.
To existing requirements in California. Yeah. In order to ensure maintenance of competency of California physicians. That's great, Tom. Thanks.
That's much more clear.
Yeah.
Thank you.
All right, moving on to 1.2. Define what is necessary to promote safe re-entry into medical practice after extended absences, including looking at the difference between the licensure requirement of re-entry, 5 years, and the disciplinary re-entry, 18 months.
Yeah, and there's some words missing from this one, too.
Okay.
So it should read, define what is necessary to demonstrate competency and promote safe reentry into medical practice after extended absences, including looking at the current difference between the requirement for retraining, for reentry, right? And this is so elided that it kind of loses it. It's kind of shorthand. So currently there is a difference between the requirement for relicensure after 5 years of non-practice. If you've let your license lapse for 5 years, you have to do some proactive training to get a license. Under the disciplinary guidelines, you have to demonstrate competency after 18 months of non-practice. So there's a discrepancy within our current practice and our regulations that needs harmonization. And so this is only to say, if there's a standard for a time certain at which point a physician for consumer protection needs to demonstrate competency through a retraining, through some retraining or proctoring, it ought to be the same whether the non-practice was due to lapse in license without discipline and lapse in practice without discipline, and lapse in practice with discipline. And
Should this also include at all any kind of collaboration with existing programs in teaching hospitals across the state?
Sure.
On a regular basis, so that just as you've put in on the first one, FSMB and ABMS, should we also be looking to a bit more of a collaborative every 2 years, every 3 years, every specific amount of time, that teaching hospitals across the state of California are engaged with with the Medical Board of California to share best practices or
so once we've defined what we think it ought to be,
right.
the
Down below,
tactic
okay,
underneath that would be
Okay.
to develop a common approach with the training institutions
Right,
in
okay,
the
so
state.
I'll put a hold on that, because that's what I put for up there,
Yeah.
okay.
And we're not going to get to the tactic level today. We're
Oh,
going to
no,
come
okay,
back with that,
okay.
but
All right, so for goal number 1, professional qualifications, these are the 2 objectives that were proposed. Would the board like to discuss any further objectives to this? And do we want to allow for public comment before assigning priority?
any further board comments?
Well, the 1.2 has been an issue since my presence on the medical board, because we go through some disciplinary proceedings and we do not really know how to make sure that these people are competent. PACE program and just education program alone doesn't cut it, so that's why we're trying to look at different venues. How can we 3 months, 6 months of additional training somewhere? I think these are the ones we need to seriously look at to see how we can get that person to up to par.
And those programs are currently very difficult to find.
That's correct.
But if we create a market for them, generally the market will respond. Comments from members of the public on the 2 objectives under goal number 1. Okay, great, thanks. Tom?
Okay, at this point, I'd like to assign a priority level to each of these objectives. So if one of the board members would like to present a potential priority for objective 1.1, obviously the general
1.1 for me would be under 1.2. I would put 1.2 above 1.1, but I don't know what, you're going to blend it both together, right?
Yeah.
So I don't understand. So this would be a high priority. Wouldn't you say? Wouldn't you say?
No, yeah, I mean, to me, these are all high priority, actually, so.
I don't know how we're going
that's
to.
generally what ends up happening. That's where the number
Right.
system kind of comes in.
So, perhaps it might be helpful to try and do this when we've gotten through it, but
Okay, we can do it at the end if you'd like.
if we could come back to these after we've had a chance to see them in context with the whole package.
No problem. All right, moving on to the second goal area, regulations and enforcement. 2.1, study disciplinary and administrative cases, including looking at physicians in training to identify trends or issues that may signal dangerous practices or risks.
And the idea behind this is that the BREEZE project is pretty much nearing completion of its initial implementation, and it should give us the ability to mine the data, which the medical board has around potentially those things that might predict early someone who is at risk for future disciplinary action. And until we're able to look at our collective experience, it's been very difficult to try and do that. It's really been a paper-based chase. And so our hope is that we will have a much better and much higher utility ability to look at things that potentially might signal an opportunity for early intervention, either at the medical school level, residency level, or in practice.
This is like the actuarial information that insurance companies gather to figure out how they should, is that similar that we'd be able to do?
It's really not actuarial, which has to do with economic value.
Well, but
It's more about manipulation of
the
data.
end result is the same, kind of. Not? They have indicated, they're indicators within, from my understanding, within that field, the ability to do exactly what you're saying.
Yeah, so to the extent that actuaries do predictive modeling,
Right, that's
this would be a look back at, for example, are women over the age of 40 more likely to get in trouble with X at a statistically and meaningfully significant higher frequency than somebody else, some other demographic.
But would it also give us the ability to take, let's say, the last 5 years of disciplinary cases and take a look at what the outcomes and maybe what might have been the predictors at?
Absolutely.
Okay, that's what I'm. Okay.
Absolutely. Or are there things, when an individual is disciplined by the medical board, are there things within the case that predicts that a certain subset of these licensees are more likely to have a second episode that brings them before the board?
Right.
As the language stands, does the board agree? We move on to 2.2?
I'm okay with it. You okay? You okay? I'm okay. You're okay?
All right, 2.2, examine the expert reviewer program and policies to determine how it may be improved, including recruitment, evaluation of experts, opportunities for education, and policies governing the board's use of experts. Fairly straightforward.
And this is a continuation of work that's already been begun, and it's in here because clearly it can continue to be improved.
Okay, excellent. 2.3, partner with the Office of Administrative Hearings and Health Quality Enforcement section of the Attorney General's Office to identify opportunities and design curriculum for the ongoing education of judges.
Any questions?
That's okay. All right. Would you like me to stop to allow for public comment?
We'll do it at the end of this section.
All right. 2.4, review the laws and regulations pertaining to the board's responsibility to regulate outpatient surgery centers and, if necessary, suggest amendments.
Yeah, it's fine.
Should there be some kind of expectation here of some minimum
Frequency?
minimum frequency, minimum standards, comparisons, regulations? I mean, should this?
Well, again, we can put that
If
under the, you know, we can, with an this will drive an operating plan in which will be embedded the frequency and how often and.
But if necessary, is that?
Well, Mr. Serrano-Sewell just asked if necessary. So since we're probably going to do this on a regular basis,
Yeah, I'd
I'm
take
hearing
out
a
if-
suggestion we take,
take it out,
if
yeah.
necessary, out.
Yeah. It's
And
always
suggest
necessary.
It's
isn't it?
always necessary. Okay.
All right. Moving on to 2.5, determine whether the board's registered dispensing optician program should remain within the authority of the board.
I don't want to be too difficult, but your numbers are different than my numbers, is that?
It's 2.9, I believe, unless you change.
Based on the edits of the document, objectives were removed, so
Okay.
I've just decided to put them in the numerical order that they would exist
Oh,
when the
okay.
documents
Yeah,
are.
because
Okay.
we got totally different.
So any thoughts on 2.5?
Any need for clarification on this? Well, it'll become apparent during the board meeting why this is in here.
Okay. Moving on to 2.6, which is the final objective proposed for this goal. Identify methods of ensuring the board is receiving the required reports pursuant to Business and Profession Code, Section 805.
Okay. Any comments or clarifying questions from the board members? If not, comments from members of the public on Ms. D'Angelo Felmuth.
Good afternoon, Dr. Levine and board members. Julie D'Angelo Felmuth from the Center for Public Interest Law. I just have two quick comments. One possible addition. Inasmuch as your investigators are going to be transferred to the Department of Consumer Affairs Division of Investigation next year, I would think you might want to add, similar to 2.3, partnering with OAH and HQE, partner with DCA's Division of Investigation to make sure that you are getting the information you need about backlogs, about timeframes, about all kinds of stuff. This is uncharted territory for this board going back to the mid-'70s when the investigators first came to the Med Board from the Division of Investigation. Also, on the last one, which has been renumbered to 2.6 regarding 805 reporting, I think you need to look not only at reports received pursuant to 805, but also 801.01 from insurance companies, reports of arbitration awards. I've been looking into a case in San Diego where a physician has slimed out of reporting multiple settlements, arbitration awards. I don't know how he's doing this. And I'll explain it better later, but I would
Was that verb slimed?
It's a new word,
The word was
isn't it?
slimed.
It's in the dictionary this year.
All right.
I think the board should take a look at all of its mandatory reporting requirements and figure out whether they are being adhered to. Thank you.
Thanks. Thanks very much. Did you capture that?
I did. Would we like to amend 2.6?
Any objections from our, great. Let's just accept that.
Okay.
I'm just curious, what are those reports? 801 reports, what is it?
801.1.
Oh, 0.01,
Yeah, I'm just,
insurance.
We could go with the language.
No,
This language is very specific to B&P.
no, I know 805 reports, I'm just trying to find out what exactly is 801.1 report is.
801.01 are malpractice settlements. So those that we receive when an individual has a case that settles via malpractice and they're over the $30,000 limit.
Oh, I
Well,
thought we already
there's several
did.
different ones. 801.01 is
Right.
a report of settlement of arbitration award.
It's arbitration insurance awards.
801 is
And
insurance
judgments as well.
reports.
Yeah,
That is the current law, I understand, is that correct? Yeah.
yeah. Yeah, so I think what Ms. Falmouth is recommending is that we not only look at the 805 reports, 805 has been one of the big drivers because of the hospital peer review reporting and the decline in the cases that we've received, but she's recommending that we look at basically, I think, all mandatory reporting and see if we're receiving them. It's hard to know what you don't know, but we'll look at how we would do that.
Thank you. And this is really about looking, as it says, it's the methods of how do we ensure we're getting what we're
Right.
supposed to get as opposed to
Outreach,
reviewing
education.
what we got.
Right.
Yeah.
Would the board mind if I change the language of this objective to identify methods of ensuring the board is receiving all the required reports necessary? Or
All
necessary
mandated reports.
Mandated.
Right.
Is it already mandated within a certain business and professions code that we should list that instead, or no? No?
We can list that under the specifics, but
Okay.
this is just to encompass the universe of
Okay.
people that are supposed to be sending us reports, and it would include certainly the outpatient surgery stuff
Oh, yeah.
when we get to that.
And then regarding the other comment, do you want me to draft an objective about partnering with DCA's Division of Investigation?
I think you could just add the DCA, where it says OAH, comma, HQES,
Comma,
comma, and
DCA.
DCA
to identify 'em.
DOI?
I think, I don't want to put words in Ms. Felma's mouth, but I think what she's more talking about is there's nothing in here, and I believe I've talked to some of the other members about this, in that there's nothing in our requirements right now or in our objectives to move forward in measuring the transition of our investigators to the Department of Consumer Affairs. And so I think that is a great recommendation to add one like that in. I think Mr. Serrano was going to bring that up at the end anyway. So I think we do need to write one that talks about some type of reporting requirement from the Department of Consumer Affairs to monitor the transition and the timelines that occur once they go over. So I'm not sure of the exact wording, but I think that that's where we need to go with that. I mean,
So are
we
you
have
recommending a separate one, or are you
Yes.
recommending a separate?
Separate
yeah.
one.
I mean, we have every intention of doing that, but to put it in our strategic plan is probably a great idea.
And it's high priority and immediate.
Exactly.
So do you want to add it in as a separate number is what I'm asking? And would you put it in it after the one that goes to OH, or would you add it at the bottom? I mean, just, it
You
needs to be
can put it in anywhere, it's
Needs
just,
to be
we need to
added.
give it the priority that it needs, I think, at this point.
And it could go under, actually,
Maybe
this
4,
goal or a
2.
different goal, yeah. It could be under organizational
Right,
relationships.
organizational effectiveness even, it could go into there, because you're still measuring your investigation. It's just being done by a different unit.
And there are
So-
two pieces, I think as you said, there are two pieces. One is that the goal of, or the objective of working with DCA to ensure smooth transition of the people and the work to Department of Investigations, and then to work with DCA to ensure we get the stuff we're supposed to get.
You might want to put the two together, because I know one thing that Tom keeps hammering me about is they have to be measurable. So it's kind of hard to measure the smoothness of it, except for by measuring the effectiveness of it. So you might want to just, that's kind of the way you'll know that it's happening smoothly, is if your timeframes go down or stay the same.
The effectiveness of the move, right.
Right,
I was talking about the effectiveness of the transition. Putting an objective, something in there about ensuring that the people, that the transition of people to DCA is done in a way that enables them to do their work and
Right.
enables us, so there's no slippage on the
Right,
work during
right.
But you have to have measurable outcomes to determine that.
Right.
Yeah, that's what, I think that, maybe we can kick that around afterwards with Tom as to how we would measure that. And then if we find that we're having a hard time being able to measure that, we can bring that back when we come back with the next meeting, so.
Okay.
All right, I'm just going to grab this and capture it, and we can polish it out later if that's all right.
Terrific.
All right, moving on from Goal 2 into Goal 3. Consumer and licensee education. This one has a lot of objectives proposed. Starting with 3.1, expand all outreach efforts to educate physicians, medical students, and the public regarding the board's laws, regulations, and responsibilities. Everyone all right with that? Excellent. Yeah. Okay. 3.2, establish a proactive approach in communicating via the media and other various publications to inform and educate the public, including California's ethnic communities, regarding the board's role in protecting consumers through its programs and disciplinary actions. All right. Moving on to 3.3, examine opportunities for the board to provide training to licensees via the internet, including hosting webinars on subjects of importance to public protection and public health. .4, establish a method for hosting public seminars taught by legal or enforcement personnel on disciplinary cases, laws violated, and other issues of importance to the profession and the public. And lastly, 3.5, review the board's public disclosure laws regarding posting postgraduate information and the 10-year retention of disciplinary information/documents. Any thoughts or suggestions on any of these objectives?
Should these be listed in order of importance, or it's irrelevant? Or should you put, within goal 3, we have 5 different objectives. Are they all equal weight, or should they?
We can reorder them once we go back and
Okay.
vote on their importance. It's a good suggestion.
All right, that is all of the proposed objectives for,
Public comment.
Public comment on the objectives under goal number 3. Hearing,
okay,
seeing none.
that one was quick. All right, goal 4, organizational relationships. 4.1, build relationships with elected officials and their staffs. Build and strengthen collaborative relationships to work toward shared interests in consumer protection and advancing the profession.
I think we can probably compress the language there. It's a bit redundant. Build collaborative relationships with elected officials and their staffs to work toward shared interest in consumer protection and advancing the profession. Got that?
Okay, start from the beginning. What do you got?
Okay. Build collaborative relationships with elected officials and their staffs to work toward shared interests in consumer protection and advancing the profession.
Sounds good.
So you're just taking out build and
Yeah.
strengthen collaborative relationships. It's repetitive.
That's it.
All right. That's spelled wrong. Okay. All right, 4.2. It's okay to proceed. Optimize relationships with the accreditation agencies, associations representing hospitals and medical groups, professional associations and societies, the Federation of State Medical Boards, federal government agencies, and other state agencies, including the Department of Consumer Affairs and the Business Consumer Services and Housing Agency. That's a lot of agencies.
Who could argue with that?
All right. 4.3, improve education, outreach to hospitals, health systems, and similar organizations about the board and its programs.
Okay.
Agree with that one. All right, those are the 3 proposed objectives for 4.3.
Any comments or questions from board members, from members of the public?
Just
Ms.
a
Ehrlich.
typo. Improve education's outreach. Either should have an apostrophe between N and S or no S.
It should be educational.
It should be
Yeah.
educational.
Okay.
Yeah. Thank you.
Better. My apologies.
It's correct on the paper.
Yeah, it was me.
Okay.
All right. Flying right through these. Goal 5, organizational
Hold on.
effectiveness. Oh, sorry.
So sorry. Under Goal 4, organizational relationships, under 4.2, why not include consumer groups as well, those representing the general public interest? Thank you. Oh, sorry, Julie D'Angelo Fellman.
Thank you.
One other typo, there should not be an apostrophe on its. ITS, no apostrophe.
You're right. Another English major in the room.
I don't have it's on my paper.
In
This is my hand scribing to this PowerPoint slide.
Could you add in 4.2 consumer organizations,
At the end or the beginning?
somewhere in the middle?
Okay, perfect.
Would stakeholders replace all of those entities? Appropriate stakeholders, or no, you want to list them out?
It's harder to measure that. This definitely has a lot of categories that are measurable.
Okay.
So maybe we could work on categories rather than naming specifics,
Yeah,
work on
specific.
some language that encompasses consumers, regulators, legislators, professional associations.
Public entities,
Affiliated
professional
professional
organizations.
associations, allied health professions,
Right.
et cetera. We'll work on that.
All right, I'll modify the language here in a second. All right, moving on to goal 5, if it's okay. 5.1, licensing applications to be reviewed within 45 days. Everyone okay with that? Straightforward.
Yeah, we're doing it already.
5.2, reduce discipline, complaint processing, and investigation timelines by 10 to 20%. Reduce complaint processing average to less than 70 days, with 50 to 60% less than 50 days.
Any comments from board members about the numbers?
Somehow, this bothered me when I was reading it, because it's not based against anything. So it's not to improve from what we did 5 years ago or 10 years ago or last week, because we have been steadily improving. I've been noticing personally when I've been reading cases that there has been an improvement in the timelines. So to say overall, investigations timeline by 10 to 20%, it's almost unfair, because if you get that one case that's going to take 5 years because there's multiple agencies and entities involved in it, it's going to bring your numbers, it's going to skew your numbering system. So I understand what the purpose of this is, but somehow I was feeling uncomfortable with the numbers, with the days. We have to do things better, I understand that, but compared to what? It's like that pain chart from 1 to 10. 10 means nothing unless you know what 10 means to yourself. That guy on the wall doesn't mean anything to anybody. So I don't know how to fix it, but I'm going to tell you that this one bothered me when I was reading it.
So 10 to 20% would be compared to current.
Well, does that mean
Compared-
every year you're going to do 10 to 20%, so at the end of 10 years you're going to be 100% improved? I mean,
Well,
we're
maybe.
talking about numbers. It's a numbers game
Right.
here.
So a 10 to 20% improvement over current, I assume that that's what that means.
Does that mean all cases? It means cases that are simple cases, cases that are
These are
dismissed
all
within
on-
20 days?
On average.
On average.
These are,
So Kim, help me
averages.
out here, because I was bothered by this.
I agree with you, and I'm getting that everybody is agreeing with you. It doesn't make sense because there isn't any starting point. So I think we do need to identify a starting point or word it differently, because you're right. Are we talking about from the prior fiscal year? Are we talking about from 2010? Are we talking about?
Maybe
I'm
before we just
with you.
did
So
this it all.
I don't
So
know if we
is-
want to say from the prior fiscal year, but then when do you get, how low do you go? I guess that's the question, so.
so it doesn't seem to me to have an unreasonable to set a goal of a yearly 10% improvement
Improvement?
in performance over prior year. But you're right, we do need to know where we're starting.
Right,
I absolutely
right.
agree.
It doesn't make sense,
Um,
so.
And
from the
it also
prior
can't be
fiscal
across
year.
the board. It has to be within,
Well, 10% improvement overall would be.
Over all of them in that year. And usually those outliers, for the most part, and I'm looking to Renee, I think for the most part, those outliers fall out anyway, because you have outliers on both sides. So your average is usually, or median is really what we should be looking at, so.
okay, if you can figure out a way to make it sound like it's,
And so we'll look
Not
at
just-
maybe the median and
it's
for
just
the
the-
prior fiscal year.
because it's,
and then
otherwise it's
Tom
number
and I can
crunching
work.
with no value.
Yep.
And that's my concern.
And so you want to change average to median in all of those, Kim?
If that makes it, if that says what I want it to say, I could go along with that. My problem is that the way we measure it currently is we measure everything in one bucket. And if you're gonna reduce by 10%,
Median enables you to actually
Bucket it out.
cancel out the
Yes.
extreme outliers.
Right.
on either side, okay, then median
Yeah.
is fine.
Median is probably what we're looking at. Okay, so we'll work on that language.
All right. 5 point.
So, what are we leaving it? I'm still trying to see what, other than median, what other change did we make?
Leave the language language exists.
I think we're going to add in from the prior fiscal year, so you're going to reduce discipline, complaint processing, and investigation times by 10% from the prior fiscal year, something like that, and then add in, obviously, median in there.
Okay.
Okay.
That's achievable goal, let me
Right.
put it that way.
Right.
And how does that impact, though, with the moving of the investigators to Department of Consumer Affairs? Do we have any?
It shouldn't mean anything. I mean, your goal is to improve your timelines, whether they're here or there.
Okay.
And if it looks like we undershot, we can change it next year
Right.
Yeah. We're paying for
and
it.
make it more aggressive.
There-
While the strategic plan doesn't have to be redone every year, the goals can be revisited every year and changed.
Yeah, I'm looking at, even though the investigators are moving to the DCA, we are paying for their services. We expect what we expect, so.
Yeah.
All right, 5.3, conduct a review every 2 years of each of the committees established by the board to determine if they are still needed, if they are fulfilling the purpose for which they were established, and determine if they should continue, be reconfigured, or eliminated. Pretty succinct.
And I think this reflected recommendations from many, if not most, board members.
Excellent. 5.4, establish a consistent approach to educating staff about the board's activities and priorities set by board members, but not limited to facilitating staff attendance at meetings.
And board member attendance at staff meetings.
Oh, okay.
Do you want me to add that?
Yeah,
Yeah, and, yeah,
reciprocal.
or in reverse.
All right.
Could you add including before, but not limited to? You should have an
What? Oh, sorry. All right. 5.5, establish a method for obtaining feedback from users about board services. From users about board services.
Stakeholders, I mean, do you like the word users? If someone's using their user, I don't know.
Yeah.
It bothered me.
Who are they?
Well, we have lots of stakeholders who don't use the services, so we would,
So how about
This is-
another, I don't know, the word users is appropriate?
Licensees and applicants.
me.
No, because the public uses it as well.
from those who access the board services. How's that?
Yeah, it's okay.
Yeah.
Those who access board services.
That's fine, that's good.
And that would include medical schools, training
Absolutely, everything,
programs.
yeah. Users.
All right, those are the 5 proposed objectives for Goal 5. Is there any additional areas that the board would like to highlight or identify before turning it over to public?
Any comments from members of the public? Our resident grammarian.
It's about spelling, isn't it? What I
How
do.
much do you want me to do this?
Not that much.
How about
This
if
is
it's,
a work in progress.
if it's grammar offline with Tom?
Preferably.
This is punctuation. Same thing.
Similar.
Offline,
Better.
offline.
So you want me to or not?
No.
Just tell Tom.
Tell Tom.
Yeah.
Okay, got it.
Thank you. This isn't the final draft. This is purely the
Work in
language.
progress.
All right. Any additional comments before moving on to the final goal? Okay. And lastly, Goal 6, access to care, workforce, and public health. The proposed objective 6.1, educate the board on the Affordable Care Act and how it will impact physician practice, workforce, and utilization of allied healthcare professionals.
You like that goal?
I like that goal. Was that a
Okay.
question?
Yes, that was a question, that was an answer.
Any comments, any additions, or? And the reason for putting this in here was, I don't mean to be facetious, is that it's pretty clear that as we implement the Affordable Care Act, both in California and nationally, it's going to have huge implications for physician workforce, the allied health professionals, and the relationships between physicians and allied health professionals. And so I think continuing to get reports to the board on what's happening in California as a consequence of this, I think is going to be really important.
All right. Is there any additional board objectives that we'd like to discuss, possibly adding to this goal? Or any?
Any comments from members of the public on this? If not, thank you very much, Tom.
No problem. Now we get to go back to round 2, which is assigning
Oh, right.
priority levels.
We're not done.
45 minutes.
Okay.
All right. For the 2 proposed objectives for goal 1, they sounded both high priority. So if it's okay, I can include high priority on both of those.
Yeah.
Yeah, I guess
Yes.
so.
Now, it was proposed to do a 2x2 matrix. Do you want me to also assign a number? If one had to be achieved?
Neither, yes, so neither, these are both high priority, but neither of them are 2014 issues. So I would put them as a 2, if you will, in terms of,
They're not immediate, right?
Well, one, obviously, with each goal area, one would supersede. You'd start with one, and if it could be accomplished first, it would be accomplished first. If it
oh,
doesn't have to be.
I see. You want to okay, sorry.
And I believe my understanding is that the strategic plan for medical board lasts 4 years. Is it a 4-year plan? So to be accomplished in the next 4 years.
Though most strategic plans don't last that long. So I think objective 1.2 actually is more immediate. I think we need more,
Absolutely.
more
I think, yes,
immediately.
that's why, yeah, we need to at least put them in order of priority within the section, I think. So within the goal number 1, is 1.1 more important or the same as 1.2? And if 1.2 is more important than 1.1, at least we need to elevate it in the
Sequence.
in the way it's written.
And this will change if this is how if 1.2 is more important than 1.1 or could be accomplished first, I would change it to 1.1.
It's more immediate.
More immediate. So it would become 1.1, and then
And
1.1 would be 1.2.
I just wanted to point out that the second one is one of the ones that came from the Sunset Review, so it does have.
Oh, good,
you know,
okay.
we do
So
have to look at it.
Okay. So moving on to goal 2, there are 6 objectives. So from the 2 pages of these objectives, we can just look at assigning a priority for the first 3 objectives.
There's actually 7. Isn't there 7 now?
Are there 7 now? Did you add a 7th?
The 7th, haven't filled the language in yet, but that would be with DCA. I can write a rough objective you'd like, just so we can assign a priority.
So I think the 7th is actually the first.
So let me ask you a question before you do that. Could it go in a different place and be at a higher level then? If you were to put it within organizational relationships, or you were to put it in organizational effectiveness, the DCA, and then if you move it to one of those other places, then you have an opportunity to have an A level versus a B or C level.
We can put it first here.
Oh, okay, then that's fine
Yeah.
too. Okay,
I'm
that's
saying I
fine.
think it
Better
is the
here?
most immediate of all of these.
Absolutely.
Yeah.
I just want to make sure we didn't
Yeah.
lose that.
Yeah.
Okay, so it's number 1.
That's number 1. Outpatient Surgery Center, which is 1, 2, 3, 4 in the list, is probably,
Should be
Number
maybe
2.
the second number 2. I think it's easier to do A and B, but okay.
All right, so if 2.7, I'm going to assume high priority because it's.
Yes.
Then outpatient surgery, you said? Also a
That's
high
fine.
priority?
Yes.
and then,
Receiving required reports is also, that's a third one. I think it's the third one.
yep,
Also a high priority?
yes.
At some point, something can be a medium priority. It's
Well, you know, I don't know why not. See, I'm a little leery about this vertical versus horizontal, because not everybody, not the same person doesn't have to work on everything. So staff has to be allocated. So you're saying that we only can have one thing on top because it's the most important, and number two, I'm saying I'm not sure why. If certain things are determined to be high level, high priority, then that's gonna be delegation of responsibility by staff to get it done, and not the other way around, so.
So, for example, in this one, probably the one that we have listed first is medium priority, since it's going to be, I think it's going to be
Yes,
some time
or
before
at
we
the
can
bottom.
actually get to it, yeah.
Yeah, so the first one can go at the bottom. See if you, yeah,
talking 2.1.
you're 2.1, yeah, you're,
And so 7,
yeah,
possibly?
put that at number 7 for now.
Okay. So we have 2.5, 2.2, and 2.3.
Well, expert reviewers,
So, the expert reviewer program,
I think that
I'd
comes
say
also.
would be the next in importance, also high priority.
Hi,
We've started the work, but needs to continue.
All right.
so you doing that 1, 2, or are you doing that on 1 through 7? Is it a 1, 2, everything under 1 and everything under 2, or are you doing?
Everything under 2 has its own separate numerical ranking. So we've got.
No, I know. Under number 2, goal number 2, there are 7
Yeah.
things.
So
And those 7 things, 3 of them can be at level 1 and 3, oh no, we're just doing numerical down the row. That's what I'm asking. That's what I'm
So
not
high,
clear.
medium, low importance, and then rank ordering.
I think we're trying to rank order them to start with, and that's maybe,
Well, so.
see, because that's what we were doing, we were
Sorry,
doing it,
I've complicated things, but.
right.
Some of these are high importance, but would not be ranked first because they're not the most immediate. That doesn't detract from their importance in the medium and longer term in terms of consumer protection or the functioning of the medical board. But for feasibility reasons, the infrastructure isn't in place currently to address it. And I would, certainly in terms of what was 2.1, I think that is a medium priority. Eventually, it's high priority, but at this point in our deliberations, because we can't actually do it.
And by the same token, if you put the last one is what we have is number 1, so it would be F or it would be number 7, you could also take the dispensing opticians, since that's going to happen anyway, it's going to take a little discussion, but it's not going to take a whole lot of energy. You could put that as number 6. No,
Yeah.
or at the beginning, I mean,
It's going to take some effort.
oh, it is going to take
For
some effort?
that, absolutely. We'll have to
Okay,
have
sorry.
interested parties meeting to discuss it. The placement of, if there was a choosing to move it, the placement of where it would go, there's some contention there. So it will take some discussion on this item.
And it has to be done.
It has to be done, so
soon.
it's also kind of immediate.
Yes,
So it
it's
needs to
one
be
of the
what, in the
ones
top
that's a
3
part
or
of
top 4?
sunset, so.
Top
Top
3,
four.
top 4. So number 4 should be the opticians program, dispensing opticians 4. But we already have 4 as the expert reviewer thing, so that's my dilemma, as you see.
Bumped expert review to 5.
So you might, is now gonna move 5? So that's what I'm saying, that for me,
So-
it's easier to see it this way, and 1 and 2, like you'd suggest, I'll go along with it, but it's just, then everything should be,
Right now you have 4 high and 2 medium at the very end.
We got them all assigned now?
Yep.
Okay.
That was the largest of the objectives, so. All right, moving on to goal 3, consumer and licensee education. We have 5 objectives. A proposed number 1 priority.
I think the last one here is probably the first one we need to address.
3.5?
Public disclosure and tenure retention, public disclosure of postgraduate information and 10-year retention of disciplinary information. It's somewhat contentious and does need to be addressed.
So the last one has to move up.
Yeah.
Okay, and I would suggest that the one that needs to move down is the one above it, establish a method of holding public seminars.
Yes.
That can move to the bottom of the whole page, of the whole report.
It's a nice to have, as opposed to a need to have.
Yeah, this is, definitely an optional.
And above that would be the one above it.
Examine the opportunities for board
Yeah.
trained licensees, yeah, that goes along with they go together at the bottom of the pile, in my opinion.
All right, so the proposal was for 3.4 to be a 5 priority, technically.
1, 2, 3, 4. 3 and 4 to be 5 and 5.
5 and 4.
5 and 4. Or 5 and 5. I said 5 and 5.
You know, I'm going to
They're
guess. on
tied
medium
for
priority.
last place in
Tied for
Barbara's
last
mind.
place, you got it?
That would
I'm
make
not
them both
opinionated at
4.
all, I'm sorry.
That would
Sorry.
make them both 4, actually, unless you want to have a placeholder for some blank 3.
I was thinking maybe you have some free time in there so you could devote some to other.
All right, I think I might have. Okay, so 3.4, 5, possibly medium priority. 3.5, first priority, high, theoretically.
So the public disclosure would be first. I would argue that, or suggest that 3.1 become 3.2,
No.
or become number 2. And then the one following that would be number 3. No, yeah, thank you.
So which one are you putting as number 3?
3.3 is number 3.
You're going to leave 3 as 3, right?
Yeah.
Yeah, okay, good.
Any suggestions or challenges from the board members?
Well, where are we at 1 and 2?
I'm sorry?
Where, number 1 is going to be,
2?
yeah, that's fine, I like it like that.
Any thoughts or suggestions on this? We good? All right, moving on to goal 4. The 3 proposed objectives: build collaborative relationships, optimize relationships, improve educational outreach.
I'd say the bottom one has to come to the top. The middle one has to come second, and the top one has to come to last. The more important one is to improve educational outreach to hospital health systems and similar organizations. I think, no?
I like to build relationships with elected officials and their staff.
Okay, that's fine.
I think so, too.
Okay. Since I already have them, I'm sorry, I just,
No, then we can put that
No,
one
no,
as
it's
number
fine.
2.
So 1, 3, 2.
1, 3, 2, yes.
okay. Is that okay with you, Deb?
It's fine.
All right. About done here. Okay. Goal 5, there are 5 proposed objectives.
I think the bottom one is important. With licensing application, I mean, I don't know how to do this, because licensing applications, we're doing really, really well. Kurt, I'm sorry, you're doing such a good job.
I would suggest combining 1 and 2. These are the licensing and enforcement metrics
Okay,
that we're setting in the plan. And I think
put them together
put them together
as number,
as number 1.
as number 1, okay.
And then we will likely revisit these numbers every year to see whether we can set more aggressive goals or how we're
That
doing.
makes sense, that's good.
Do you want me to merge 5.1 and 5.2 into
Yeah.
one objective?
Could we have them as separate, but just do them both as one? Because that way we can build, they're different items that we have to build under them.
Okay.
Hmm?
No, just.
You didn't have any public comment on number 4, does that matter? There was no public, okay.
Just
So number 5, so to take number 5.1 and 5.2 and put 5.1A and 5.1B? Is that what you're?
I would just, I think Sharon's got the right way to do it, and that is, they touch on licensing and enforcement, obviously, but you know that from reading it. And let's see how it looks in one combined objective.
Kim is suggesting they're different goals.
But when you start going down to the details,
Yeah.
you're probably talking about different people doing the work.
It still can be incorporated under the, you can have different tactics assigned to different staff people under an objective. It doesn't, I mean, another way of stating 1 and 2 is, these are the measurable outcomes of our 2 key functions, which we're setting numerical goals for, and saying that that's the highest priority in terms of how others will, and we will judge ourselves and others will judge us in terms of organizational effectiveness. Can anybody hear me?
I can hear you, sound very good, except you're losing your voice.
Yeah.
Make sure it says 10%, it's set by 10.
Yeah.
So would the board like me to keep it as 2 separate objectives?
No, one objective, combined, 5.1,
Review licensing applications within 45 days. Reduce discipline complaint processing and investigation timelines by 10% from last fiscal year. Is that correct? Prior fiscal year. Reduce complaint processing median to less than 70 days, with 50 to 60% less than 50 days.
Let me just ask you a question about those 2 specifically, since that's the main focus of what the responsibility of the board is to be. Should they now be changed in goals to that should be your first goal versus your last goal? Your organizational
No.
effectiveness, or no? How do you do that? It's okay?
I think it's okay.
Okay, as long as it's okay, I'm fine.
Yeah, they're not, the goals are not in priority
Okay.
of importance, they're not in order of importance.
Okay.
And I think the rest of these can stay as they are.
All the high priority?
Yep.
Well, wait a
No.
second. So staff, educating the staff about the board's activities and the board's activities about the staff, is that more important or less important than feedback from the users about the board services? You think it's more important to have, it doesn't matter?
Doesn't, you want to change it, that's fine.
I mean,
To me, they're high importance.
yeah, that's why I was just wondering, all of them are high priority?
Yeah.
Then we have basically nothing which is medium and low. Okay, that's
They
fine.
don't have to be all high. If there's a proposal to switch it to a low, medium or low priority based on resources.
We want it all. We don't want just half of it.
So I think I heard a recommendation to move the feedback from those who access board services to higher than the educating board and staff about one another's activities. So just switching
Yeah,
those
I
two.
would. I mean,
So in that
but
order,
I could be wrong.
1, 4, 3, 2?
Sounds good.
Are any of them medium priority? The evaluation of committees? High priority?
That's probably medium.
That's medium priority for sure, because the chair can always change
Other than
it.
one, everything else in my mind is medium, but
Other
other than the top one, everything else is medium, but go along.
Or you disagree?
Educating the board, is that a high priority or a low priority? Staff and board? Or medium, I mean, not low, but medium? It's high?
I think we can go medium.
huh?
I'm just suggesting medium.
Medium,
I
fine,
think
fine,
so,
medium.
too.
Fine,
I was so opinionated in the beginning, I didn't want to still be opinionated.
that's okay.
Yeah, I think that's it for goal 5.
Yeah.
And then goal 6, there's one, so it doesn't really need a number. And I'm going to assume high priority.
Yes.
Okay, that is it for evaluating the strategic plan.
So just, I want to give the members of the public any opportunity to comment.
Can we have the air conditioning turned
And I will. We're just,
If we have the air conditioning turned down, there's an energy crisis in the state of California, I'm sure, somewhere.
okay.
Maybe not in Riverside.
So I'm going to, seeing no comments from the members of the public, I'm going to move to agenda item 5 and ask for a motion to adjourn the meeting.
So moved. Oh, second. Sorry.
All in favor?
Aye.
Just wanted to wrap up a couple slides.
Oh, sorry.
No problem.
We thought
I
we'd
just wanted to
finish.
give you an idea of the next steps from this. So obviously, I'm going to take this back to Kim and work with staff, and we will assign tactics to each of these objectives. And then we will submit that revised draft to the board for adoption at the February board meeting. And then upon that, we'll release it to the board website.
Not sooner?
That's pretty much it. Thank you very much.
Not sooner?
It's our next board meeting.
Why don't you do it for 3 years? Yeah, so in 3 years. we'll do it.
Okay. You're welcome, Tom.
Thanks.
And you got active participation.
Definitely did. Thank you very much.
So we have a motion to adjourn and a second. All in favor?
Aye.
Any opposed? Great. And are we meeting back here at 4 o'clock? So for the enforcement committee, and see if we can warm the room up just a little bit. And thank you all for your patience.